Okay, since we came together here from many different countries and specialities and professional backgrounds, I think it's important that we share some really basic information and key features of Japanese Kampo medicine and the current situation on the international level. Okay. Well, Kampo medicine is the Japanese version of East Asian herbal therapy. It was adopted from China approximately 1,500 years ago, but has independently developed in Japan. Therapy does not focus on single plants, such as you see here, like cinnamon or ginseng, but on a well-composed traditional prescription. The traditional prescription is central, and its allocation to the symptoms and complaints of the patient. Here you see one example of 7 components, Kakonto, a very well-known cold medication. One other special characteristic of Kampo herbal drugs is that there was a dramatic reduction of the number of herbs and prescriptions compared to traditional Chinese medicine. In Japan, there is a long tradition to ensure best quality of crude drugs, which have to import it from China and other East Asian countries, and are also cultivated in part in Japan. And then there is a fine Japanese cut, and this ensures high quality of quantity of active ingredients despite low dosage. Today, modern standardized spray-dried extract products have in most cases replaced the traditional decoction in Japan. They are registered as drugs, and there are both OTC drugs and prescription-only drugs for doctors. The unique development of Kampo took mainly place in the Edo period, which was between 1600 and 1868. One very important protagonist, one physician, was Yoshimasu Todo. He was an advocate of abdominal diagnosis. And since then, Fukushin, the abdominal diagnosis, is one special key feature of Japanese Kampo medicine. There is an allocation of a typical abdominal finding to a prescription. Here you see the abdominal finding for Hachimigan. And this pragmatic approach is also expressed by the words of Yoshimasu Todo: the physician should only rely on what he can see and palpate. So a pragmatic reduction also of speculative concepts took place in the Edo period. Another development which also is characteristic for the Edo period is that pharmacies emerged, marking the spread of Kampo into the general public, the citizens and the merchants. Before, Kampo medicine was mainly available for the nobility, for the aristocrats, for the samurai, but not for the normal people. So easy-to-use Kampo products were promoted and sold for self-medication and travel use. Famous are the Inro, these Japanese medicine cases, which can be carried on when traveling. Today, Kampo is well integrated into Japanese healthcare. There has been a revival since the Second World War, and today Kampo is registered as drugs, as I already said. So there are more than 200 prescriptions registered as OTC drugs, and 148 of them can be prescribed and are covered by the National Health Insurance System. So this makes it possible that all physicians may prescribe Kampo medicine. And as you can see here, 84% of Japanese physicians prescribe Kampo herbal products. So we have to ask, are they all specialists of traditional Kampo medicine? Well, no, not all of them. Yeah? So most of the Japanese physicians know a few number of Kampo prescriptions from their own specialty, and they use those which have a really good evidence in the background, which are research related and covered by research data. And if you look at the top indications for Kampo products, you can see that it's very similar to the German situation, that we have indications like common cold, constipation, muscle cramps, stomach complaints, menopausal symptoms, bronchitis, allergies, exhaustion, and sleeping disorders. So these are all indications where you can use a well-established Kampo product according to a modern diagnosis and according to a pragmatic symptomatic efficacy profile. Here you see a typical scene of a Japanese pharmacy where you can choose among Kampo products. I'm often asked by medical doctors here in Germany, so why can't we just use Kampo medicine according to modern indications? Is it necessary to learn the traditional Japanese Kampo approach? If you want to really treat complex diseases, and if you want to take in account the constitutional aspect of a patient, then you have to study the traditional approach of Japanese Kampo medicine. And here are some selected indications where Kampo has been proved, in the sense of evidence-based medicine, to work very well. And we can make a distinction between kind of central ways of action, and here you see the focus on neurovegetative and endocrine regulation. We have functional gastrointestinal disorders like functional dyspepsia, irritable bowel syndrome, where Kampo is really effective. Then we have the field of dysmenorrhea, menopausal disorders, infertility. We can use Kampo medicine successfully, and also exhaustion or burnout. Then we have the focus on the improvement of microcirculation, which is very important in the field of diabetic angiopathy, like neuropathy, cerebrovascular diseases, stroke rehabilitation, metabolic syndrome, or tinnitus, headache, and migraine. Also very, very thankful indications for the use of Kampo medicine. And on the third place, we have the focus on immune modulation. So we have very complex diseases like allergies, bronchial asthma, allergic rhinitis, neurodermitis, the susceptibility to infections, for example, in children, autoimmune diseases, rheumatic arthritis, SLE, ITP, UC, morbus Crohn. Here, Kampo often plays the role as a supplementary therapy, complementary therapy to the conventional therapy. And another indication would be tumor fatigue, side effects of oncological treatments. We had a session on the ICCMR Congress just 2 days ago. So what is the traditional diagnostic and therapeutic approach? Just very short. First, the doctor has to conduct a very detailed anamnesis, and this means that he listens carefully to the patients. He makes a really thorough interview, and he takes into account some aspects which you normally would not ask a patient. For example, about his temperature sensation, about his vitality, the condition of his stomach or his intestine, and his fluid distribution. So questions like this are really mandatory for a Kampo diagnosis. And then follows the bodily examination with a careful inspection from the top to the toe. And we concentrate on Fukushin, the abdominal diagnosis, where you get very important information which help you to select the right prescription in the end. Also the tongue diagnosis and the pulse diagnosis, but the abdominal diagnosis is leading. Then you have a variety of symptoms and findings you have established from your patient, and then depending on the depth of your knowledge of Japanese Kampo medicine, you can classify this by traditional criteria. I can't go into detail here, but that's what we are learning in our Kampo courses, to do this classification by traditional criteria. And then you have a specific patient symptom pattern called SHO, and you directly allocate it to the prescription, the whole, the efficacy profile of a prescription. So these are really directly linked, allocated, and this is the miracle of Japanese Kampo medicine. So just to give you one example, the famous prescription Rikunchi-to, 6 gentlemen decoction in Japan, it is composed of 8 components, not of 6 like in China, and it has been established in the 16th century. So the traditional efficacy profile, the SHO, is weak patients complaining about epigastric fullness and pain, nausea, tendency to diarrhea and feeling of coldness. And there are specific tongue, pulse aspects, and also a specific typical abdominal finding with an attention here in the epigastric area, splashing sound below, and also a weak area below the navel. So if you find this, and if you find at least several of these symptoms, you can say, well, this fits together. Yeah? This is the profile of Rikunchi-to. Modern interpretation has taken out these main aspects of the symptoms. This is the epigastric problems. Yeah? So modern interpretation says stomach disorders, gastritis, and functional dyspepsia. These are the indications. I think here in this example, this is okay. Yeah, you can do this. So the weakness of the patient and his coldness is left aside, but still we have the main aspects which can be transferred in a modern way, interpreted to a modern diagnosis. And the pharmacology, which has been conducted in really a huge extent, shows that there is a regulation of gastric motility, of gastric emptying. There's a stimulation of the gastric mucosal perfusion, very important. And there are numerous clinical trials, among them 2 double-blind placebo-controlled clinical trials. So just one example, and we have of course more complex prescriptions here, which cannot be interpreted just to one modern indication. For example, psychocation 2, there are at least 10 indications for which you can use it. So that's the difference. So on the international level, what are the key challenges? How can we establish and maintain the supply of Kampo crude drugs and products? We have various legal and regulatory systems in our different countries, and Dr. Eberhard will go into this question just in a few moments. The second challenge is, how can we implement Kampo medicine into the healthcare system of the respective country in view of various professional positions and insurance systems in the different countries? So we think the key measures are symposia, lecture and conferences about Kampo medicine, just what we are doing here at the moment, and education of healthcare professionals in Kampo medicine. So the first thing you all know, we have this International Society for Japanese Kampo Medicine, which has the task to promote and enlarge communication and collaboration among English-speaking practitioners and researchers who are dedicated to and identify with Japanese Kampo medicine. And we are doing international symposia, as you can just have an impression here. And the other point is education on an international level, and we have education programs in the United Kingdom, mainly performed by Gretchen de Soriano, and here we have herbalists who sort of represent Kampo medicine, but they are integrated in the national health system, and they are allowed to dispense and prescribe herbal medicine since the era of Elizabeth I in the 16th century. So a complete different system than, for example, in Germany. We have Japanese Kampo medicine in Austria. Dr. Bernd Korstner is conducting Kampo courses in cooperation with the Austrian Association for Acupuncture, also for medical doctors. And we have our courses in Germany, organized by the German Medical Association of Acupuncture, the DECFA, with 9,000 members, MDs only. And we already have Kampo courses since 1988 by Dr. Ulrich Eberhard, and now since 2011, we both, Dr. Eberhard and me, are conducting Kampo courses independently or within a master program of East Asian medicine.